Cutting Edge, a special presentation from Global News. I'm Katherine Ward, Network Health Reporter. 2024 was a remarkable year as scientists, doctors, and healthcare teams from across the country and around the world pushed the boundaries in medicine. For example, drugs like Ozempic and Wegovy have become household names for patients looking to manage diabetes. But these semaglutide medications are showing potential to help people in other ways, as are other drugs in the ever-expanding GLP-1 category. New research published this year shows the drugs can help people living with kidney disease. Other research found an association between the medications and a reduced risk of hospitalization for those living with an alcohol use disorder. More studies are underway to find out what else GLP-1 drugs could help with. The SELECT trial, a global study, has shown the drugs can improve heart health. We caught up with the Toronto doctor involved in the Canadian arm of this research, who says the discovery is a major breakthrough.
My chest was a little bit tight and I was feeling sick and I was sweating and I was hot.
Richard vividly remembers his heart attack in 2019. Within a week, he was in Dr. Subodh Verma's operating room on Christmas Day for double bypass surgery. Richard, who asked Global News to use his first name only, says it was a wake-up call.
You think this is it. I mean, I might not wake up from this experience, right? This guy who I don't know is going to cut my chest open.
The surgery was successful. Dr. Verma also suggested Richard take part in a phase 3 clinical trial, which was measuring the effects of semaglutide medications on overweight and heart health, a departure from their other well-known use as a tool to manage diabetes. Luckily for Richard, Dr. Verma was leading the SELECT trial in Canada.
We've had no therapies that actually reduce weight and reduce heart disease at the same time.
Dr. Verma says the results published last month are a breakthrough, helping understand what else drugs like Wegovy and Ozempic can do to help patients.
What we measured objectively in the trial was that fewer people died, there were fewer heart attacks, and there were fewer strokes. And that all came with a approximately 10% reduction in body weight.
Richard lost about 45 pounds using semaglutide and has been able to maintain much of that progress even after coming off the drug by changing his eating and exercise habits.
You don't have to just go along and feel like terrible all the time. That you can change your life, and there is hope.
Dr. Verma says Health Canada's approval of Wegovy this past November for both obesity and heart health is very encouraging for patient access.
If we think of this sort of comprehensive, holistic strategy in our war against cardiometabolic disease, this is one profound tool.
The 2024 Nobel Prize in Medicine was awarded to a pair of Americans for their discovery of microRNA, which, as the name suggests, are tiny RNA molecules that play a critical role in how genes work at the cellular level.
MicroRNAs are important for our understanding of embryological development, normal cell physiology, and diseases such as cancer.
The Nobel Assembly said Victor Ambros and Gary Ruvkin's discovery is proving to be fundamentally important for how organisms develop and function. With more research, the findings could be used to create new diagnostics and treatments. Along with the prestige of the big win, the two scientists will split 11 million Swedish kroner, valued at just over $1 million US. Medical innovation takes creativity, determination, and intellect, but also money to back it up. Every year, St. Michael's Hospital Foundation in Toronto hosts one of the largest pitch competitions in the country. Teams showcase their research, hoping to win big, including one doctor working to find a cure for sepsis. Dr. Claudia DeSantos has been researching sepsis for more than 15 years.
The last big discovery in sepsis was in 1928. It's just mind-boggling that we have not been able to better fix this problem.
DeSantos and her team have been working to find a new way to treat the life-threatening medical condition where a person's immune system malfunctions facing an infection. An estimated 1 in 18 deaths in Canada are caused by the condition. DeSantos is using microRNA and nanoparticles to develop a new therapy to limit cell damage.
They actually bind and inhibit the molecules that are causing the immune dysfunction in patients, thereby helping the immune system fight the infection.
DeSantos hopes her research will be able to move into human testing by 2026. Research like this takes time and comes with a big price tag. DeSantos shared her research and vision at the 10th annual Angel's Den competition put on by St. Michael's Hospital Foundation in October. Melissa Martin is the co-chair for the event.
This is really to jumpstart innovation, and that's what it was about, to really support early stage researchers, because you have to have results to get results. Well, how do you do that if you have no money?
6 teams competed for $700,000, each one looking to solve a real-world problem.
And the best part is these doctors, most of them are clinician scientists. And what that means is they see patients and they have a lab. And so that's what's so interesting, just because they've all been motivated by a problem that they're dealing with their patients.
Dr. Claudia DeSantos and her team were successful in taking home the People's Choice Award. In the end, they received $125,000 towards funding their work. Behind many treatments are groundbreaking drugs, and they need to be made somewhere. Omnia Bio opened a new manufacturing facility in Hamilton, Ontario this fall, and Global News got a behind-the-scenes look in October. This is where the company produces cell and gene therapies. The company says it leverages both artificial intelligence and robotics to create, trial, and commercialize drugs, including some forms of cancer therapies. It's billed to be able to reduce costs and boost efficiency so patients get faster, more affordable access to the care they need.
We get the benefit of knowing that there's a patient at the end of everything that we do, and that's really motivating for us and for our staff.
The facility can produce CAR-T medications, which are tailored to an individual cancer patient's genes. Pocket Health is flipping the script and putting patients back in control of their medical information. The web-based platform uses artificial intelligence to help patients prepare for their doctor appointments. It took Christy Dickinson from Burlington, Ontario, nearly 7 years to realize she was living with an uncommon genetic disorder.
I was diagnosed with Ehlers-Danlos syndrome, which is a rare connective tissue disorder. It impacts basically my whole body.
Keeping the medical information flowing between doctors has taken up a lot of her time.
I am under the care of 11 different specialists across 3 hospital jurisdictions. I had to be the conduit that tied all of that information together because our system is so siloed.
Now she uses a web-based platform called Pocket Health. The system partners with hospitals and labs, and it allows patients to access and share their images and reports.
So as a patient, especially if you're going through a fairly complex care journey, you often feel like a ping pong ball. You're bouncing around from place to place. Your doctor didn't get this fax from this place. Your surgeon didn't get the CD, so you had to bring the CD in. And what that happens, it means that there's often delayed care.
Pocket Health offers different levels of service which patients can pay for. The most basic option has recently been made free to use. Co-founder and CEO Rishi Nair explains the platform is now using artificial intelligence to help read patient data.
We've built a model that actually gives patients a list of prompt questions for when they meet their physician to ask about their radiology report and about their healthcare more broadly.
Health and science policy professor Tim Caulfield says there can be unintended consequences on the healthcare system with this type of technology.
It can lead to overutilization, it can lead to anxiety, it can perhaps lead to unnecessary visits to your family physician, and maybe even visits to the emergency room. We've seen that with direct-to-consumer genetic testing.
But for patients like Christy, the tool has helped save time and fill in the gaps.
Any anxieties or potential situations that I'm worried about, I don't have to spend it all trying to be an accurate historian.
Scientists at St. Michael's Hospital in Toronto have developed technology that can scan and more accurately diagnose kidney problems, which would be a major upgrade to the current standard of care. Here's an up-close look at how it works.
Every single time I order a biopsy, I cringe.
Dr. Darren Ewan knows even though a biopsy is one of the most standard ways of finding out what's wrong with the kidney, the procedure comes with risk, as he illustrates in this demonstration.
Whenever you stick a needle into the kidney, it's going to cause it to bleed. And 1 in 10 people will get significant bleeding to the point that they actually could get into kidney failure.
But a chance meeting in the hallways at Toronto's St. Michael's Hospital led to an unexpected collaboration. Enno Heisey, a medical biophysicist, thought his work in understanding ultrasound frequencies could help.
Simply because the sources of sound in fibrotic or scarred kidneys are different from those in normal and healthy kidneys.
Current technology wasn't refined enough.
So we've had ultrasound for decades. The problem with ultrasound is it only can see big things, so something like a tumor or a kidney stone. It can't see something that's microscopic like scarring.
Scarring is a sign of kidney disease. The pair work together to create software to enhance ultrasounds.
So each and every single one of those kidney components has a very unique pitch. Our job here is to actually be able to recognize that pitch, detect it, and use that information.
Ultimately, what we plan on doing is having it like an app which you download for your phone, an app that you would download for your ultrasound machine.
Offering both a bigger picture of the kidney and taking away the risk of using a needle.
To be able to say that I was able to make it so that people don't actually have a bleed, people don't go into kidney failure, that's really the reason why I went into medicine.
The next phase is to get clinical data for regulatory approval and then to make the program widely available. Innovation sometimes starts with the smallest of creatures. Scientists have fully mapped the brain of a female fruit fly, a step along the path to mapping larger animals' brains and eventually humans. Though the brain was less than 1 millimeter wide, the map contains more than 130,000 neurons and 50 million connections. They learned there are substantial similarities in wiring between individual brains, suggesting each brain isn't a unique structure like a snowflake. After the break, we sit down with Health Minister Mark Holland as he explains the government's plan to modernize healthcare systems across the country. Welcome back. Access to family doctors and nurse practitioners has been a challenge for millions of Canadians. In our year-end interview with Federal Health Minister Mark Holland, I started our conversation by asking what kind of role his government hopes to play to get people better access to primary care.
So a really big role. We signed bilateral agreements with every province, every territory. It's $200 billion over the next 10 years. That's really going to help transform primary care in a lot of ways. One of the most important ways is to have common indicators across the country so that we can see how provinces and territories are doing on things like number of doctors, number of nurses. We need to revolutionize data and how information flows. And why is that important? Because far too much time of doctors is taken with bureaucracy and paperwork.
But when are Canadians going to see tangible results? I know that there was that report that was the baseline data that you collected, so now we have something to measure against. What can you tell us?
Well, look, we signed the digital charter in our last health ministers meeting. It was to create the framework for that. What came in the bilateral agreements where there's real dollars and commitments around integration of health data and access to personal records. We don't want our doctors using fax machines and triplicate forms and taking all kinds of time on paperwork when they could be seeing more patients. So we can activate the capacity of our system. That's why Bill C-72 is so essential. And then working with InfoWay, looking at the incentives we can give with the right support from provinces and the federal government, they could digitize 7,500 family doctors' offices a month. Imagine what that would mean to interconnected care. Imagine what that would mean for reduced wait times. Yes, there are absolutely things that aren't working in our health system, and I acknowledge those, and we have to look straight in the eye and be honest about it. Right now we have a health system that's based on illness. We wait for people to get sick, and then we pay unbelievable amounts of money to manage them once they're sick. 70% of chronic disease and illness can be avoided.
So let's talk about the dental care plan, because that was a really big part of your year as well. What would you do differently if you had the chance to do it all over again?
Well, look, I think in life you're crazy if you wouldn't do something different, because it always, life is a process of learning. But the thing that I really appreciated about the dental care program was that it was co-creation, and so that even the mistakes led to really deep partnerships. We rolled up our sleeves and literally dental office by dental office met with people, and I was all over the country listening to people, trying to make the program better and understand their world. And now we're at over 90% of oral health professionals participating, including more than 90% of dentists and certainly hygienists and denturists. So those conversations led to really important iterative improvements.
I would be remiss if we didn't talk about COVID-19 a little bit. And now that we're sort of out of what probably was the height of all of that, I want to ask you about the report that the federal government commissioned reviewing its response to the pandemic. Can you tell me, so in the report, it emphasized urgency and transparency, but it was withheld for several months. What happened there?
Well, I think, in all instances, we want to make sure that we're metabolizing not only the learning, but that we have a response. Is something important as the pandemic and pandemic preparedness. You want to demonstrate that you not only understand what you can do better, but how you're going to respond to make sure that you fill in those gaps and do it right.
So you wanted to have your response ready before the public knew what the report said?
No, not necessarily. I think that what I'm saying is that as you're sharing information, you have to be able to share a thoughtful response about that information so that people can see, how we are responding to what that information is. And I think that's appropriate. We need to be making investments in both pull and push measures internationally to make sure that we have the right drugs to be able to deal with this reality. You got to fight the invisible. If you do a really great job, nobody will know you ever did it, right? And that's perhaps the greatest success of a health system, is invisibly doing the things that people have no idea that you did to keep them safe and keep them healthy.
We've covered a lot of ground in this conversation. At the end of the day, what grade would you give Canada's healthcare system as a whole?
I think what Canadians should expect of us is progress every single day, so that you can see that line of progress, so that we're getting better and better. We're not going to transform overnight. Anybody who promises it is lying to you. What we are capable of doing with the existing amount of money we have reconfigured towards prevention and avoidance, we would have a society of so much less illness, so much more productivity, so much more economic capacity. And it is that I am so passionate about, and see not only the potential of, but see us actualizing it.
Minister, thank you for this conversation today.
Thanks so much.
Just ahead on Cutting Edge, how YouTube is helping people wade through misinformation to get accurate health information online. Welcome back. If you've ever been sick and logged onto the internet to figure out why, there's some good news for the quality of information you may be receiving. In the spring of 2024, YouTube expanded a program to Canada that identifies doctors and health experts who are sources of accurate information. This accreditation shows up on a banner underneath videos identifying the creators as licensed. YouTube's algorithm also boosts their content.
We act and remove content that is harmful or otherwise may result in a bad outcome to community and to users.
Those who spread misinformation, they're nimble, right? They can work around these kinds of verification processes and actually use the verification as a way to legitimize misinformation. That's going to be a challenge. But given how problematic health misinformation is, I think we've got to start trying stuff.
Applicants to the program undergo a strict approval process in hopes of fighting online misinformation. Determining whether a patient needs brain surgery contains shades of gray. A team of doctors at St. Michael's Hospital in Toronto have developed an AI model that helps take out some of the guesswork in the decision. Take a look. This moment encapsulates a challenge doctors face on a weekly basis.
Neurosurgeons in the province of Ontario get over 20,000 urgent calls per year from outside hospitals that don't have neurosurgical support.
Dr. Chris Witu is reading a brain scan of a patient in another city. A nurse holds the phone to his ear in order to maintain sterility. The surgical team stands by during the emergency consult, waiting to get back to the patient on the table.
And many of the times, the referrals are actually things that maybe could have waited, but seem to be urgent at the time. And so just as an example, about 80% of the referrals probably could have waited.
The team at St. Michael's Hospital in Toronto built an AI model to help make those preliminary decisions, dubbed Assist TBI. Radiologist Dr. Errol Kolek explains.
So this tool was trained with thousands of head CT scans. We want this to run in the background, automatically process CT scans, and if a patient is triaged as someone who needs urgent neurosurgical intervention, we want this to basically be an automated alert for the physicians.
The model isn't meant to replace doctors. Instead, it's designed to catch brain bleeds that could go undetected. The team says the results speak for themselves.
This tool was compared to board-certified neurosurgeons and actually performed as well and maybe even slightly better than the neurosurgeons in identifying neurosurgical bleeds.
Mohammed Mandani says it has the potential to save lives.
1 in 10 to 1 in 20 bleeds are routinely missed. 1 in 10 to 1 in 20 bleeds. That shouldn't happen. We need these algorithms in community hospitals, in smaller centers that don't have the specialist resources that we do.
The team believes the technology could be expanded to screen for bleeds in other organs too. But for now, the next step is for the model to be tested at another hospital before seeking Health Canada approval for a wider rollout. Katherine Ward, Global News, Toronto.
Still to come, the hologram will see you now. How new technology is changing the landscape of rural medicine. We'll be right back. Doritos chips may be a key to unlocking medical innovation. Scientists are investigating what else the dye known as yellow number 5, which is used to give the salty snack its signature color, can do. Researchers used the dye to create a temporary window that made a mouse's internal organs, muscles, and blood vessels visible through its skin. This has not been tested on humans, but the discovery could create some interesting possibilities in the future, such as making it easier to see veins for blood draws, assist with early cancer detection, and make laser-based tattoo removal more straightforward. The doctor in a box will see you now. Virtual visits from a hologram consultant are a new experience for cancer patients in rural Tennessee. Dr. Clay Jackson says his patients are responding well to the hologram, which makes it feel like he's in the room. The technology has been used for film, TV, and sports leagues, but this is the first time it's been approved for health consultations.
My ability to kind of beam into the offices and be able to see them in those rural clinics without having to sort of do the Methodist circuit riding preacher approach is really great, because it just allows us to access more patients in their space, which is very convenient, and it's patient-centered care.
The hologram device costs $29,000 US. Thanks for joining us for Cutting Edge 2024. For more that we just couldn't squeeze in, you can catch our health coverage online at globalnews.ca. I'm Katherine Ward. See you next time.